Okay, we're recording.
Ah.
So today I'm not going to do the interviewing. I'm not going to ask the questions. Brian, my husband, is going to ask the questions because I accidentally became someone that has maybe useful information for people. So I, about 3 weeks ago, started feeling unwell, and then later found out that I had COVID-19. And when I shared that with people, I just started getting a lot of questions. I found that a lot of people don't know anybody that's had COVID, or they're just kind of. I think a lot of people are really hungry for information, and so we thought, as actually Brian's idea, he just was like, "What if I asked you some questions?" And then that way, people could listen to this, watch this in their own time, and maybe it would be helpful.
So I get to take over guest hosting duties this newsletter, and I get to see how you're doing.
Yeah,
Turning the tables.
yeah.
It's a fun time here in the Tom Ding household.
Mm-hmm.
Yeah. Okay. How about, would you like to start by describing the kind of first symptoms that you had, the first things that you knew you were at least sick?
Yeah, and I do want to say up front too, I have had a personal experience with COVID-19. That does not make me an expert in COVID-19, right? I'm going to share what has happened to me just in case that's useful to other people. But I think one of the things that makes this thing so tricky is that the way the virus presents in each person is very different. But part of the reason I wanted to tell people I had it is because basically the first thing that happened is I thought maybe I was getting a sinus infection. And like I just had a little bit of it's not even head congestion because I didn't end up with any mucus or anything like that, but just kind of like that ears get stuck, like pop like a couple times a day, and I just wasn't feeling great.
Yeah.
Not like
I remember distinctly that you were kind of nasally, but like you were coughing and clearly had something up here, but it wasn't like mucus. Like it didn't present with like snot coming out.
right, and I just remember thinking I just don't feel great.
Yeah.
You can let Darcy out, by the way.
Can I?
Yeah, we can
to the viewers at home, the scratching sounds you hear is our dog being a jerk because she doesn't like being trapped.
I'm not going to stop recording. There's no need to.
She runs this house.
I mean, I asked her if she wanted to stay in there.
She did until we started talking, and then she wanted to be outside.
Yeah. So, okay. So, sort of felt like a sinus infection. I also had a headache. I don't get a ton of headaches. So, but also, I don't know. It felt like a sinus headache up here.
You're also very in tune with your body. Like as an outside observer, you tend to know when you're sick earlier than like when I know that I'm sick.
So. Yeah. So that was maybe day. I want to say I started feeling a little unwell Monday, and then definitely noticed on Tuesday. So if we think about Tuesday maybe being day one, if we want to call it that. So day 1, 2, and 3, that's kind of all I felt was a little bit of some sinus pressure, and a headache, and then just feeling tired. Like I remember I laid down in the afternoon. That's not something I would normally do.
Yeah.
And yeah, so that's how things started. No fever. Not really a cough, no like throat pain or cough or anything like that. And within the first couple days, that had kind of was even maybe a little better.
Yeah, and you've had tiredness before because you had mono a couple years ago. Was there a difference between this type of tiredness and that type of tiredness?
This definitely felt, and later it felt even more like I just felt kind of spacey in my head, like tired in my head. Whereas not necessarily in my body.
Okay.
So.
What was, had you talked to your doctor at that point, like after?
Actually had. And we'll talk about this maybe when we do the Q&A, but I had texted her and just said, I think I have a sinus infection. You got any suggestions? And so she gave me a couple of suggestions, but when it was Friday morning when I woke up and realized I couldn't smell or taste anything.
That was the shocking twist.
Well, that was the like, oh fuck. You know, like, oh, this might be something a little more serious.
Yeah. For me, that was the point where I don't care if you've been wandering around the house coughing because you have a sinus infection, and then all of a sudden it's just like, oh, she's been wandering around coughing, potentially with COVID.
Yeah. So I reached back out to my doctor because, I mean, that was a signature thing I had heard about.
Yeah.
And she just said, hey, why don't you go get tested just in case? So Friday morning I made an appointment, because I've also had some people reach out and be like, where did you get tested? Because you can go to the free places here in town. And I know someone that went and it went fairly smoothly and they got their test results back in 3 days. So like that is an option, but there are lots of places in town that if you have insurance, they'll do the test for you. So there's a CVS if you live in Dallas, in West Dallas, on Singleton. And so I basically, on Friday, I made an appointment to go on Sunday because that was the earliest appointment. Yeah, so that's kind of what we did. And at that point, I still kind of thought maybe we were just being cautious.
Yeah. We got to CVS, and unlike, I think, some of the other ones where you see a nurse practitioner or a doctor actually jam the thing up your nose, you got the other experience.
Yeah, this was slide it through the slot, I self-administer. But it's not the one that like pokes your brain. It's just It just went up like 1.5 inches. So uncomfortable, but not unbearable.
He was a very patient nurse practitioner who was just like, okay, you're gonna shove that 1 inch up. Yeah. Okay, farther. Okay, now twist 3 times, and I'm gonna count back from 15.
Yeah, and it was fine, and that was a perfectly fine experience. I will say though, by the time I got there on Sunday, I was feeling worse.
Yeah.
And I think, again, a couple times I might say this has been my experience, and anecdotally what I've heard, it lines up with similarities from other people in that I think most of us are used to getting the flu, and the flu kind of hits you and you feel the worst you're going to feel at the beginning. And in my experience, COVID is a little sneaky. I also want to say, I didn't really say this before, but I had a really mild version of this. And so, it wasn't.
You never had a fever, did you?
No fever, and no painful cough, and no throat, none of that pain.
Yeah, I think at one time you had one temperature check that went into the 99s.
It was like 99.1.
Yeah, and then it went back down.
Like 2 hours later. Yeah. But by Sunday, I was feeling bad enough. And it was like day 5 that I really started to not feel great. And that kind of lines up with what I've read about people talk about, like day 5 through 10 are kind of going to be the hardest usually, depending on, again, your symptoms and all that. So I went and got the test, went home. And I would say at that point, this is why I was like, I don't have anything I've ever had before. I basically felt like my body had moved into like low battery mode.
It was hibernating.
Yeah, I kept saying I feel like I'm hibernating. And this is pretty atypical, I think, but my heart rate got really low, like into the upper 30s at night. And I just felt like I kept saying how how you can turn the brightness up and down on your screen. I felt like I had turned the brightness all the way down, but for my brain.
Yeah. And I will say that was your heart rate monitor on your Fitbit.
Yeah, which is not like I never had to go to the hospital. I never had to see anyone in person. I think maybe some people. I just stayed in touch with my doctor via text message.
Yeah, so. But hey, like as we always say with our Fitbits and Apple Watches, like it's nice to have that data because you can tell change when it happens.
Yeah, and it was definitely on average much lower than normal. Yeah. And I just was really, really tired. And then again, like my brain just felt like it wasn't working very well.
Yeah, but personally, that's why I was worried at that point that perhaps it was like some sort of secondary mono flare up when you were getting really tired, but the fact that you were able to really communicate that it was up here, it was mental tiredness, not pure body tiredness like you had with mono. Um,
Yeah.
so that was at least productive for me as an outside observer that this
Yeah,
was this was different.
it felt a little different.
Yeah.
Um, and then so when got tested Sunday, then the weirdest thing happened to me, and I don't know how many people this has happened to, but in the middle of the night, like while I was sleeping, I started scratching my hands. And when I woke up in the morning, I realized it was because I had like broken out in like hives or a rash, particularly like all over my legs and arms, but like my hands and my ankles and my elbows like had these real itchy patches. That has never happened to me before. Again, not alarming, not scary, but like very unusual. So
Yeah. It
when
wasn't
I
like festering boils or anything. It was
no, it was just very
red splotchy
uncomfortable.
patches. Yeah.
Yeah, and so
Itchiness, I think, was probably the more frightening thing than the red patches appearing.
yeah, and so I checked in with my doctor, and she said it's a histamine response, and likely means your body's mounting an immune response. She just said take some Zyrtec, and that actually really helped. So I was like not just like itching all over my entire body and that lasted for 2 days.
Yeah.
And then it took maybe a day or two more. Like I just remember on maybe day 12 really kind of being grumpy because I just was looking for a sign that I was getting better. I don't know how anybody that's listening to this, I don't know how you feel about sickness, but I don't have to be better in a day. I just need to feel like I'm making progress.
Yeah.
And again, I think this something, if anyone is watching this that has somebody in their life with COVID, like a mild case even, or maybe you have it, it just has a long tail, longer than
Yeah.
I think most people are prepared mentally for.
And I think
Again,
that tail can be flat. Like you had said earlier about the flu, and I think one of the things for me when I get the flu, like yeah, I kind of like go off the cliff the first couple days, and then I have the flu, and then you have that sort of magical day, night, whatever, where you get a good night's rest, and you wake up and you're like, I feel better.
yeah,
Like you go down, but then you go up. And I
yeah,
feel like this one, like you've gone down and like you were kind of down there. You weren't getting worse, but you weren't getting better for like a couple of days there. And I think that's really where mentally that was as
yeah.
an outside observer, that's where that was grating on you the most. And then we could see a little bit of uptick.
Yeah, well, because I was like, I was too tired to even watch TV. Like that didn't even sound fun. Um, and then I can't remember if there was like day maybe 12 or 13. I woke up and I just felt a little better.
Yeah.
And that's when I thought, okay, I can, because I also, at that point, so I got the test done on Sunday and it was supposed to come back in 3 to 5 days, but it took a full 7 days. I didn't get it back till the next Sunday.
Yeah.
And so
And I think by the time you got it back, it was anticlimactic in some ways.
at that point, I kind of felt, I mean, I felt really confident I had it. And also, it had been almost 2 weeks since onset of symptoms. But around then, I was feeling good enough to tell people. Like, I didn't want to tell people when I still felt really sick because I just didn't want people to worry. And so that's when I put it out there. And I had, maybe this is a question you were going to ask me, but they think the couple days before you start feeling bad, and then the first couple days you feel bad are when you're likely most contagious. So I had seen 2 people in person outside from a distance, and so I reached out to them and kind of let them know what was going on. They have both been fine, and so to my knowledge, it didn't go any further than me. Yeah.
Okay.
So that's kind of the that's my main COVID experience story. So I don't know if you've got any other questions for me.
Well, how are you feeling now? Now that because now it's been, I'd say, a week of you steadily
Uh-huh.
getting better.
Mm-hmm.
Uh,
I
where
would,
do you think you are right now?
I would say up until maybe 2 days ago. So what would we say? like basically if you want to go to like day 14 through 21 ish, so that third week, I was 80 to 85% most of the time. With having, but the things that are lingering for me are kind of dips in energy, and I don't necessarily feel like my mental focus is entirely here. And I still can't taste or smell properly. Like I'm drinking this coffee and it literally doesn't taste. It either doesn't taste like anything or like it doesn't taste very good. And anybody out there that's lost their taste and smell completely or partially, you know that like sometimes when you can taste or smell things, it's like weird. It's like certain layers of taste and smell, but not the full thing. And so it can make food be a little strange. So,
Luckily, you've been able to taste salt and bacon and
so I would say I can
some
taste
lime juice.
the really big categories of flavor. So if you think about like salt, sweet, sour, like sauerkraut, you know, I can taste spicy, but I cannot taste a lot of the flavor underneath the food, like the difference between
brisket and pork.
Or or like fruit, or like two different chopped up roasted vegetables. That there's not a lot there. It is coming back a little in that like maybe sometimes I can taste like 10%, or like we were in the car earlier and I was like, is there a skunk outside? And there was. But like yesterday I burned something in the oven because I couldn't smell it. So it kind of like, it's not one of those things where today my smell and taste is at 10% and it will stay at 10% until it gets better. It's like this really weird.
It's like a zigzag where I also feel like sometimes you've been able to taste something and then 15 minutes later, that same thing, like you almost blew that fuse. Like, you know, it's like, ooh, a blueberry. And then 15 minutes later, it's like, man, this is just mush.
Yeah, or I'll taste dinner a little bit and then I wake up in the morning and it's like we're starting over. And I think, because you know, it's like people are like, wow, it really sucks, and they're right, it really does suck, but I am trying to keep it in perspective, and again, having talked to my doctor, it's very normal to not have your taste and smell back for 3 to 6 weeks. And so for my own psychological well-being, I just keep reminding myself this is very typical. It will come back. I just have to be patient.
Awesome. Well, personally, I'm happy that you're feeling better, because that also means we get to hang out again. So that's nice.
Yeah, I'm hopefully a little more interesting to spend time with.
Yeah, I'll take 85%, 90% Liz over 15% Liz, who I was very happy to go get baby aspirin for. But other than that, we just slept a lot. It was kind of sad.
Yep. Yeah.
Running out of good TV to watch.
I am glad to be feeling better for sure. Yeah. It's just been a strange. It's been a weird one.
It's been a weird year this month.
Yeah, for sure.
Okay. You solicited a bunch of questions that I've sort of broken out here from friends and other people on the internet. The $1 million question that I know you've gotten a lot, but it appears to be the thing everybody wants to know. How do you think you got it?
Yeah. How did I get COVID-19? The very short, unsatisfactory answer is I have no idea. Yeah. I don't know anyone in my life that has said they had COVID. But what I think I would like to do to kind of flesh this question out is think about like, because I think really what people are trying to figure out is,
are they being safe enough? Was there something where you're like, oh yeah, I probably shouldn't have gone and open mouth kissed a bunch of random strangers in that crowd that one time, or I shouldn't have gone to that Nickelback concert. Like they want to know that there was like a clearly bad thing that you did.
Yeah, and because so they can make sure to avoid that thing.
Yeah.
So I think though this is a good opportunity for you and I to talk about how we've been making decisions about what we do and don't do.
We've said risk for us is a spectrum. It's not things are completely risky or completely safe. Because like completely safe is like seal yourself in your house and have everything delivered and sanitized and sit under UV light for 5 days before it enters in your quarantine and send it through an airlock. and
Right. And
completely risky is those open mouth kisses at a Nickelback concert.
right.
Um, you
And
know,
I think we kind of tried to say if that's the spectrum, we know like 0% risk isn't gonna happen. What's one step from that look like? And that's kind of where we started. And we also tried to go with, and we kind of continue to try to go with best current understanding of the virus.
yeah,
So current best understanding is that, indoors without masks is a really great way for one person that has it to give it to somebody else.
yeah.
And so
It
that
seems like aerosolized transmission seems to be the most common. It's not the entirety of it. Like there still can be surface to surface, but that aerosolized from talking and singing and yelling and all that sort of stuff in an indoor environment where those aerosols land on each other instead of being blown away by the wind seems to be the worst.
just imagining a scenario where I'm singing and yelling. I don't know, that was pretty funny. Yeah, so that, and then knowing it's less likely to be transmitted on surfaces, like all of that kind of has put us in a place where we don't spend time indoors with other people, period.
Yeah. I mean,
The only time we do that is when we need to go to the grocery store.
yeah. And I go to the grocery store Thursday morning, 2 minutes after the store opens. I have my whole like airlock procedure as far as like I'm in, I'm out, I wipe everything down, I get in the house, I clean everything off, I wash my hands. I do that
Yeah,
whole
you have like
procedure,
a whole
and
re-entry routine.
yeah. And then you go to the meat market.
Mm-hmm.
You were
Like
going once a week, but now it's more like every other week
every
or
other
every
week.
3 weeks.
And that's, I mean, those are our indoor things. Last month we started seeing 1 to 2 people every once in a while for like outdoor social distance stuff, because I think for us it is about like, okay, if risk is a spectrum, what are we getting for taking one step? Going to the grocery store, we're getting food. That's, and then if we're going to spend a little more risk, how can we responsibly have some social engagement, knowing
Yeah.
we're probably, from March when all this started, we're likely going to be living like this for a year. What can we do to get a small amount of social interaction, a small amount of family engagement, to help balance mental health with everything that's going on. So
And those have been,
that's,
hanging out on porches. We got some box fans for our porches just to make sure there's extra air breeze. Plus, it's just hot.
yeah.
Um,
So again, this is why I don't know. I don't
yeah,
know what happened. I, I've had some people ask if I would do anything differently. And of course, when I thought about the 2 people I saw outside, I felt pretty awful about that, because at that point I wasn't feeling 100%, but I thought I had a sinus infection. So I definitely laid there feeling incredibly irresponsible for a long time. But, I've checked in with them. They're fine. They felt like we handled that situation appropriately. Like we didn't touch any of the same stuff. We didn't really even get near each other. And so I think the interaction was actually pretty low risk. I don't regret that earlier in June we went to a Black Lives Matter march.
yeah. I'd
I
say
don't regret that at all.
that's probably the riskiest thing that we've done. But we wore masks. We didn't linger there. But it's a big crowd.
Yeah. I
But
also
I'm
don't,
I'm happy we went. Like I would not take that back. Like given
yeah,
the choice.
I don't regret that we went to Costco for the first time since February, earlier in June. Like those are kind of the standout things, but I don't regret them. I feel like they served a purpose.
Toilet paper
Toilet paper
was a
was,
very important purpose.
yeah, like, but I also think, and this is maybe no one asked for my advice here, but this is as I've been saying, it's a little bit like staring at the sun directly. You don't really want to do it for too long, or you'll burn your eyes out. I could make a calendar and go over every action I did. But I'm never going to know the answer.
Yeah.
And the best I can do is let that stop with me. And I feel comfortable about our level of engagement or lack thereof with the world. You work completely from home now. I lost my job in March and then just decided to kind of finish up my health coaching program. So like we're both completely homebound.
Yeah.
So that's a much longer explanation about that, but I do not know how I got it. I do not, I'm not out having chips and salsa at my favorite Tex-Mex restaurant every night, or any night. So that's and I think that makes people, I've talked to several people who it makes them really anxious that I got it. And I mean that, that makes two of us. Super not ideal and feels really weird.
Yeah.
But
I mean, I think that's something that people need to come to grips with, is that again, like any amount of going out is going to expose you to some amount of risk, because you just don't know who's randomly going to be next to you at the grocery store, or who's going to randomly cough at Costco. Like, life happens. And I think that's about, like, there's ways to mitigate that, in the sense that, like, maybe your whole family doesn't need to go to Costco. Like, if you're going to send somebody to the store, send one person to the store instead of sending the whole crew to the store. And making sure that people, like, we've been masked up the whole time, but continuing to mask up helps, not just for you, but when other people mask up, it helps slow that spread.
And I think, my experience with people reaching out to me is there's a lot of anxiety right now still. I think there's lots of reasons for that. There's just so many unknowns. And I think there are so many uncertain things, both about how the future is going to play out, but also because we don't have a government that's disseminating a cohesive message. People are kind of left to figure it out on their own. And so, I think for people out there that are really anxious, and for good reason, like there are people that are immunocompromised, right? There are people that like have pre-existing conditions, just all these things that make it more likely they could get really sick. I think I would just ask people though, like where the line between like accumulating information that is helpful, that informs your decisions and helps you be, as low risk as you can be. Like there's that amount of information. And then when you are seeking more information beyond that, is that helpful? Is that producing anxiety? Like, and what are you seeking when you're like seeking more information beyond what's actually useful for like planning your life today?
And that's a good segue to one of the questions, which is, where, beyond your doctor, where have you been getting information from? Like, where are your sources that you turn to?
I mean, I read a lot of news articles. Are you just talking about COVID stuff in general, or once I got sick, what did I start doing?
I'd say when you started to get sick, where did you go to sort of get information or validate things?
Well, I definitely Googled every symptom I was having with the words COVID-19 afterwards. I mean, I certainly did that, and I'm not sure I recommend that. I also found a really great explainer from Harvard's kind of public health website that, if I can find it again, I'll link in the newsletter. And it was just because I was trying to find a summary of like kind of every best known things about COVID, what you could expect. And those were the kinds of things I was wondering. Okay, I've been sick for 6 days. What happens next? When's that danger zone where things could turn? When am I out of the woods? And so that was a really good, helpful, kind of succinct informational page. the thing I've heard most recently that's been helpful, you shared it, but there was a podcast from New York Times, The Daily, and they did like an update on 4 things where we are now with COVID. And
what we know now that we didn't know before.
And the thing that was so interesting to me about that is that they current thinking, and if you watch this 3 days from now, current thinking could have changed.
This is a novel coronavirus, so we learn things as we go.
But they think it could be a vascular.
Yeah.
If that's the root of it, is it a vascular disease? But that's why it shows up in the lungs and the brain and the kidneys and sometimes your toes. Anywhere there's these tiny blood vessels, there's like opportunity for problem.
Kind of why when you think about like where did the rash appear? Well, it was in all those little areas like your elbows and your toes and your fingers and your arms where you have lots of little vascular.
So that's everywhere. Just fascinating. I spent a little time reading about other people's experience with COVID, and that was helpful to a point. But I will say, for me, it started to make me anxious.
Yeah, eventually you can hear too many people's experiences with COVID, and it freaks you out a little.
Yeah, and I started to get freaked out a little bit when people would be like, "Oh, wow, you might be sick for, you could be sick for 4 weeks, you could be sick for 6 weeks." That's totally true. But like getting anxious about it definitely wasn't putting me in a good space.
Yeah.
So I did a little bit of that, but then
especially if it's vascular, raising your blood pressure is not good.
Yeah, I had to just kind of, for now, for me, turn that slice of information off. And if symptoms come back, then I'll check in with my doctor. But that's kind of where that, and maybe that's the type of information that right now for me is not helpful.
Yeah, that's a nice pivot to talking about one of the questions somebody had was, were you happy with your healthcare from your doctor? And you have a very interesting setup with your doctor, so I thought that would be good to go into.
So the too long didn't read there is, yes, super happy. But it's a much longer story that if anybody that's watching this wants to hear about how I found my doctor and ended up working with them, I would be more than happy to talk to you about that. But when I had mono and then later, I found out I have high cholesterol. Fun fact. I just was really, really dissatisfied with how conventional.
Take a pill.
Just kind of the regular healthcare system handled that. I'm not against prescriptions, but I was just interested in a more well-rounded approach to that.
You were willing to do the work and make lifestyle changes and wanted somebody that was willing to do that work with you. So
all that led me to kind of leave the traditional healthcare model, and I see Dr. Kathy Supavong. Some of you that are watching this may know her. She and her husband Joe used to live here in Oak Cliff, where we live, but now she has a practice in Fort Worth. But it's basically a subscription model. So I pay a flat fee every month, no matter how much I use her or not. But she is available to me. I can literally text her whenever I want. And I only have to go over there once, twice a year in person, unless I really need something. But I will say, not that we're spending the time on it, not that it's the topic, but like my annual exam, I spend 90 minutes with the doctor and we go over everything. She answers any question I have. It's incredibly comprehensive. It is what healthcare should be. It is what relationships with your doctor ought to be. And it's not because doctors in the kind of traditional system don't care. They just literally, that model does not allow them for time to spend with patients. And I also want to just acknowledge that, like, the fact that I can pay for that, that is money that we have that is important, and I've decided it's worth it, and not everyone, like, it's not affordable for everyone to go on that model. Anyway, that's a whole other story, but like one of the reasons I am a health coach is because I feel passionately about like making lifestyle changes to better your physical and mental health. And I want to be part of the solution that helps people actually feel better, be healthier.
I'd say it was nice to watch you just be able to like the morning you woke up itchy with hives,
Yeah.
you could just shoot a text off and be like, hey, when you get a chance, I broke out in hives. And she could be like, okay, great.
Yeah.
This is probably what's happening. Go get Zyrtec. Um,
So,
and
yeah.
like that to me is like, oh my God, that's what doctors should be doing instead of like, well, I guess sign up and come to the office and deal with my nurse for 45 minutes so I can come in and look at you for 3 minutes and then tell
Right.
you to get Zyrtec.
And someone asked about cost. Like, I didn't pay any more this month or last month than I do normally. Like, that is all, again, it's like however much you use her or not. So I was super happy. I've been in touch with her at first it was like every 3 days. And she's just still, she's still keeping an eye on things, but it felt really good to have a medical professional to talk to about it. And I would also say to people out there, this is hard, because if you don't have insurance, I totally get why people don't have a primary care doctor. But if you do have insurance and you've never gotten established with a primary care doctor, at least maybe take 5 minutes to think about, if you did get COVID, who would you reach out to? Like, who is your medical professional that can like advise you? Because it took a weight off of me to be able to consult with somebody. And so it might be worth your time to just at least think through, if this happens, then what am I going to do? Kind of situation.
All right. We had one last question, and that is, through all this, what would you have done differently?
There's another question that I'll ask you in a minute when we're done.
Okay.
Just thought of it. Yeah, what would I have done differently? That's maybe, as soon as I even signed up for the test, maybe I should have told the people that I saw outside. That was a hard one for me though, because I didn't want to run around. I know I'm recording this like Zoom right now and asking people to watch it and listen to me talk, but I felt very strange about raising my hand and being like, everyone look at me, I have COVID. And so I didn't want to be like girl who cried COVID wolf. But at the same time, you want to let people know, so if they know they could potentially have been exposed. That is the only thing that kind of weighs on me, is like the ethics of communicating that. But I feel lucky that I didn't have to do a mental inventory of like every day for
the
a
list
week.
of people you had seen in person was 2.
Pretty small. So I think that is also one. I mean, it's like everyone has to make those choices, but like it's about how much contact are you having with people right now. It's just another consideration. So.
Yeah. Are you going to change contact with people now that you've had it?
So this is a weird one. I do not plan to change I plan to wear a mask when I go out in public. I don't plan to change my behavior there. And we'll talk about this in a second, but like, we don't know if you have any, we kind of are operating under the assumption that you didn't have it and you don't have antibodies. So I think almost nothing about our lives will change, but because I do have antibodies now, I do plan on doing a few things that involve one other person. Like, my hairstylist reached out to me, and so I'm probably gonna get a haircut. I haven't done that, and I would not have done that had I not already had COVID. But to me, it's there's one other person involved. They know my situation, and they're comfortable with it. And so a couple of those things, but like, it's also like, we don't know how long antibodies provide immunity. And so I don't want to be thinking I have antibody bucks to spend, 4 or 5 months from now, and I don't. Because as much, for me, a lot of the ethical stuff is, as much as I didn't want to get it, I don't want to be responsible for spreading it to other people,
Yeah.
because there are plenty of people out there that if they get it, they could get very sick. And I, just literally wouldn't want to be part of that, but also my own conscience, I would struggle.
Yeah. Part of it's
with
just
that.
also modeling good behavior for
Yeah.
society in
Yeah.
general. Like, we're
So
all in this
like
together.
95% of things won't change. And there'll be a few things I do. And we even talked about it. Like, I'm probably going to start, if errands that need running.
You can go to Costco now, and I will not.
Yeah. Yeah. So anytime I can kind of get out in front and protect you, I'm happy to do that.
Thank you.
And that's where there were some questions. People had questions about, like, did you get tested? What did we, like,
Yeah.
what's up with Brian? How's Brian?
I'm great. The short answer is, so at first we thought Liz had like a sinus infection. So yeah, she was coughing around the house, but we didn't think much of it. And like, our house is not big. Our house is 1,100 square feet. There's 4 rooms, and we both work from home, so we're here together all of the time, often in the same room together. So whatever she was expelling, I clearly breathed in. Like, there's a 0 chance that I did not breathe in Liz's air. And by the time we felt like it was time for her to get a test, we weren't really even certain. It was more of a CYA thing than we legitimately thought she had it. That quickly turned, and by the time it was clear that she probably had it, again, I had been in close contact with her for weeks, so I just sort of treated it as, I probably have whatever she has. I'm just asymptomatic or whatever. So, that locked me down, like, from, it wasn't a complete house lockdown. I still went to my 1 weekly attempt to go get food. But I went with a double mask instead of my normal face mask that I had. I went with a mask with a face gaiter over it, just to sort of double tamp down whatever I am potentially expelling. And just, made a conscious decision to get in and out of the grocery store quicker and stay farther away from people when I was at the grocery store. Other than that, I stayed around the house. I mean, I work on the computer all day long in this room. I did get a test. I got an antibody test this Monday, because by the time Liz got her nasal swab test back, I would have been out of the range of, if I had it, getting a nasal swab at that point. Like, everything the CDC's website said, they didn't recommend I get a nasal swab because I probably wouldn't have enough virus load for the swab to work. So they recommended wait an extra week and go get an antibody test. So that's what I did this Monday. And I got the test results back negative, no antibodies. But that test has a pretty high false negative and false positive rate. And the false negative rate is measured against hospitalized patients that are confirmed to have COVID. It's not measured against the completely asymptomatic public. So all that data doesn't really help give me a ton of clarity. It's a data point for me, that I'm negative, and I should still treat this very seriously and pretend that I don't have it or haven't had it and I don't have any immunity for it. But also, until we have more reliable diagnostics and know more about antibodies and what that means for asymptomatic people, I don't have confirmation one way or the other. So I'm just going to continue to try to play it as safe as possible and stay indoors and limit my exposure. I'll still probably go to the grocery store because I enjoy going to the grocery store. It's my one time to leave the house. But same deal. I will continue to be very cautious and try to stay away from people.
I'm also not as good at picking out beer for you.
No.
So I feel like going to the store, you get the beer that you want.
Yeah. It's the summer of sours.
Also, not that you would bring this up, but like, you were really great. You took great care of me. You've made me lots of salty food. It was like a lot of bone broth, honestly, a lot of like meat, if anybody has paid attention in the last couple of years, that's very normal anyway, and then it was just lots of cooked veggies. I did lose my appetite for a couple days, but it's very unusual for me to not eat even when I'm sick. So I mean, I quickly, whatever weight went away temporarily, like that came back. And I have also just thinking about recovering. I don't, we started going on some walks again. Once the doctor kind of said that was okay, and the doctor said I was past that window of time where you're likely to transmit the virus.
The other complication through all of this was the day that Liz got her confirmation that she was COVID positive back, our AC died. So
we had to have a completely new HVAC system installed in our house.
At that point, we had bunkered ourselves. I bought a window air conditioner, and our 1,100 square foot house got reduced down to a 300 square foot this office that we're in, because we could put a window AC in this room and stay somewhat cool. So at that point, I mean, in for a dime, in for a dollar. I was exposed to every germ you could possibly expel in the smallest possible environment, and somehow came through this with no antibodies. So, man, this thing's random.
Yeah, fair. And I think if it's okay with you, that's kind of it's not a fun wrap up, but I mean, there's just a lot of uncertainty.
Yeah.
I know people want uncertainty, or they want certainty. The other thing I would say is, risk is a spectrum, but also the way this disease is presenting is a spectrum. And I think most of y'all that are watching this, I probably don't need to tell you this, but people that think it's just the flu, it's not. It's weird. And the mild version I had.
Yeah, the mild version you had was still worse than any time I've seen you with the flu.
Yeah, it was just, it's just weird, and then that's the good version of it. And there's a whole bunch of other versions that are worse. I also think there's a group of people running around that think, oh, if I'm healthy, I'll be fine. And that's the whole, like, risk is a spectrum. Not everyone that is healthy will be fine.
I'd say of the two of us, you are healthier than I am.
Yeah, and I think in the end I will be fine. But being quote unquote healthy doesn't mean you don't get sick. We don't understand why some people get sick and some people don't. There's probably genetics, environment, lifestyle, there's probably a million things that affect that.
The virus is constantly mutating, so all kinds of substrains and whatever.
And only some of that is in any one of our control. And I think that's where it comes back. It all comes down to getting as clear as you can about what you can control, using the best data that you have to shape your own personal code. Like we have like kind of rules that inform our decisions. So we don't, in the moment, we don't have to make a million decisions. We already kind of know what we will and won't do and why.
And I think that was very helpful going into this, that we had spent a lot of time honestly communicating between us where our risk tolerances are, and then communicating with our family and friends and other people and just being very honest about it. And, sometimes that's annoying. Like, I know parents really want to see us. And I know it's, I miss out seeing on our friends. But it's been nice to have those conversations. So again, in the middle of it, when there's time to make a decision about something, like we were already there when we actually had to start making hard decisions.
Yep. All right. Does that do it?
I think so. This has been fun.
Yeah.
I promise not to show up in your newsletter ever again.
You can. Okay. Well, never
really
say never. You never know. So, right. Okay. All right. Well, I would say talk to you later, but you're literally down the hall.
Yeah, I'm literally down the room. So.
If anybody is still watching, if there were things we didn't answer and other questions you have, again, remembering in the kind of scope of like, I've had an experience with COVID. I am not an expert in COVID. Send me a message. I'd be happy to answer whatever questions that I can. Yeah, but other than that, that's it. So, okay. Bye.